Hi, I'm Siobhan Sarna, and very happy to be here with Dr. Kenneth Brown. So Dr. Brown is a board-certified gastroenterologist, a mouthful, and he has been a contributor to my work in chronic condition rescue and SIBO SOS since the beginning. He has a lot to offer. He has worked with the likes of some of our famous researchers on papers like Dr. Mark Pimentel. He has a very, very, very busy in-demand practice in Texas, where he sees thousands of patients and has been able to take a lot of applications from research and try them out in the clinic, and then comes up with like cool workarounds and out of the box thinking. These sessions with him always are very entertaining. No pressure, Dr. Brown. And he's also the creator of Atrantil. That's how he got me to pronounce it properly. A lot of times I wanted to say Atrantil, but it's Atrantil, which is the only clinically shown supplement to help with bloating. We'll talk a little bit about that because it's so interesting for anyone who has bloating or intestinal methanogen overgrowth. It is something you should definitely look into. Sometimes people say, I tried it, it didn't work for me. And Dr. Brown has some tips for you about that. But most importantly, we want to welcome you. Glad you're here. And I know Dr. Brown has a great presentation. I'm going to hand things over to him. Hi, how you doing?
Well, thank you so much for having me on, Siobhan. Again, this is, you always keep me on my toes when you ask me to come here, because I feel like I need to think outside the box a little bit and discuss things, because you do always have these great researchers and speakers and doctors that come on this whole SIBO SOS process. And I am honored to be here, and thank you so much.
Well, we can't wait to learn from you and get some inspiration. I know a lot of people are just getting started, and then there's a whole huge group that's really discouraged, feels like they've tried everything. And Dr. C. Becker and I always say, have you really tried everything, or does it just feel like that? Which we can relate to too. So,
well, just really quick on that, as somebody that sees people over a long period of time, what I have noticed is trying everything sometimes means trying everything for a longer period than you initially expected. So
exactly right. So maybe it will work, like they say in 12 steps, don't quit before the miracle, right?
Exactly. And that's one of the things that we're going to talk about today, that maybe things that you are doing could potentially be helping other parts and other aspects of your life. So
let's get clear about who Petunia is here. She is the producer and the director and the one running this house. Thank you very much. Okay. Sorry. She's very demanding, the talent around here. I'm telling you, Dr. Brown.
I like what you said, be nice or be gone. I feel like that should be the platform for a presidential campaign.
We're not going to talk about politics or religion, but I think it's good words to live by in general.
Right. I love that.
All right. I'm going to hand things over to you. We're going to learn from you today. Can't wait.
Share screen.
Yeah, that sounds great. Perfect.
All right. Do you see that?
I do. It looks fantastic.
Okay. You know, something that we've never talked about before, we all have our whys and different moments that affect us. I have never told you that 6 years ago, a mother brought her 18-year-old, I'm an adult doctor, so I only see people that are 18 and up, brought her 18-year-old severely autistic son to see me. And she said that he's become combative and no longer verbal. And she was struggling, because what she did notice is that after he ate, he would become more aggressive. And she was hoping by bringing him to a gastroenterologist like myself that I could offer something. And when I examined him, he was very full of air. Tympanic is what we percuss the belly. And he was very bloated, essentially, but he's nonverbal, so he wasn't able to communicate this. Looking at this, we know that there is this brain-gut connection, and I treated him aggressively for SIBO and Xifax and Atrantil motility agent. And she came back 3 months later and was in tears. And she said that this is the best he's been in over a decade. He was communicating with me at this point, and she just wanted to thank me. And it was that moment, it was 6 years ago, where I went, this is bigger than me. This is an obligation, and this brain-gut connection is something that has to continually be pursued. What I'm very excited to show is that other researchers are really now looking at this. And so today I want to discuss SIBO and the fight to heal your gut to protect your brain. And by protecting your brain, you're also protecting your body. For those of you that don't know me, my name is Ken Brown. I am a gastroenterologist, and I have actually been involved in this space early on. I did the original studies with Dr. Pimentel. He was the primary investigator, and we were a leading enrolling site in the country for the Xifax article that got published in the New England Journal of Medicine. So I've been sort of swimming in this space since 2009 when we were doing the study. 2011, it got published. So today, what I would like to go over briefly, because of your audience that is so educated on this, we'll just review SIBO briefly. I want to discuss these molecules called polyphenols, the structure and the role, and then do a much deeper dive into the future of where this is going, which is the metabolites and the microbiome, and then how this all relates to brain health. Now, getting to SIBO, and maybe many of you who are listening to this, you might relate. Typically what I see are second opinions, and I will see a person who is extremely frustrated. They present with pain, bloating, constipation or diarrhea, brain fog, weight gain or loss, and frequently a newly diagnosed autoimmune problem. And they have been told, don't worry about it, by several specialists because it's only IBS, irritable bowel syndrome. And everyone here realizes that IBS is just a trash can term. You just have to have pain or change of bowel habits lasting more than 3 months with negative workup, and then you're going to be called irritable bowel syndrome. The most common symptom of bloating isn't even part of the diagnostic criteria. Now, we know that the small bowel should be sterile. The microbiome that we're always discussing, that's 100 trillion bacteria, greater than 1,000 species living in your colon. So when something happens, and there's lots of various reasons, post-infection, motility issue, it's looking like the motility process is really the root cause of all this due to different things, but bacteria start to grow in the small bowel. And when they grow there, every time you eat, the bacteria break down the food before you can, and ultimately cause bloating, distension, these different symptoms. The thing is that if you have SIBO dysbiosis, you're going to have inflammation. We know now that when you have this inflammatory process going on in the gut, then this leads to intestinal permeability. This intestinal permeability turns on this cascade of inflammatory cycles. Specifically, different cells are involved. I have right here the mast cell, because what's interesting about that is that releases histamine, but it also releases the different various things like the histamine and a few other things that go directly from the enteric nervous system, meaning the guts in the nerve, or the nerves in the gut, directly to the nerves in the brain. So inflammation is the root cause of disease. The last time I was on here, Siobhan, we talked about aging, and I discussed a term called inflammaging. That's the new term in longevity that people are talking about. How do we stop this inflammatory process? So if somebody's told, don't worry about it, you have IBS, but it's SIBO, then this is why we're seeing so many other things pop up. When people come to me, they have other issues: rosacea, acne, coronary artery disease, liver issues, depression, fatigue, sleep disturbances, chronic pain, restless leg, pelvic pain. The list goes on and on. Now, this is the root cause of the inflammatory process starting in the gut. So IBS is not benign if it is caused by this, and that's what we're going to try and find some different ways to help. But this audience is probably like, oh my gosh, we know all this because we have the queen of SIBO who put out a great book. Who put out a book, Healing SIBO. So I hope that everyone that is listening to this has read this book. If you haven't, shame on you. Go do it as quickly as possible, because she discusses all this and how she came out of hers, and it's a great story. So the whole aspect of SIBO, just remember that there's lots of research going on. If you suffer from this, you have wonderful people like Siobhan putting on webinars, writing books, trying to help people. So let's talk about where my research is going right now. Research that is moving on really is coming down to these molecules called polyphenols. Now, polyphenols are the molecules that make vegetables and fruits very, very colorful. This is something that people are throwing around a whole lot now. You will see that there's lots of supplements trying to discuss polyphenols. What people don't realize is that not all polyphenols are created equally. Essentially, these are building blocks. So if we were to think about this, I apologize, I'm gonna have to use my cough button. My allergies are murdering me here in Texas right now. If we're going to think about this, Mother Nature builds these large complex polyphenols. And so it starts out as a small phenolic compound like catechol, and then hydroxyl groups are put on and it's slightly larger one like gallic acid, which is really small. Then all of a sudden we have a flavonoid called resveratrol. So these things are just building. Then quercetin is a slightly larger flavonoid. Then a bunch of quercetins can come together and form a anthocyanidin, a proanthocyanidin, and then you put a bunch of those together, and then you have a large, stable, complex polyphenol like a tannin. So it's this movement of where the science is going right now about how to best utilize these various flavonoids, polyphenols, and ultimately large, stable tannins. Now, I think I've discussed this with you, that ultimately metabolites are where everything is going right now. It's the metabolites. There was a study that was published by Dr. Silvia Molino, where she looked at the antioxidant capacity and what happens when you metabolize a tannin, quebracho, and chestnut through an in vitro gastrointestinal digestion. What that means is she took quebracho and chestnut, she put it through an oral phase of digestion, a gastric phase of digestion, and then ultimately an intestinal phase of digestion. And then she saw what was in there. Then she took that was left and she fermented it, meaning she put it with a microbiome of healthy people. And what she found, which not many people talk about, is the tremendous metabolites that are actually produced when you ferment these molecules. So large stable polyphenols, large stable tannins, just the top 18, and the list goes on and on and on about what's being produced, but you have smaller phenolic compounds like gallic acid, catechin, those two that I just showed you. You have procyanidins, which are larger polyphenols. You have green tea extract. You have more tannin tetramers that are kicked off. Urolithin A, urolithin B, those are relevant because that works on something called mitophagy. It gets rid of old and sick mitochondria. Then you have ellagic acid and quercetin. I show this because people don't really understand that they're going out buying a lot of supplements, but the reality is that a lot of this is already there in Mother Nature if you can actually break these down in the appropriate way. Then in the same study, what she looked at is another bioactive metabolite. These are short chain fatty acids, compared to inulin. Now, inulin is the gold standard of prebiotics. It is considered the prebiotic that is used most of the time when discussing that. So when people say take fiber to feed your microbiome, ultimately what she's showing here in this study is that the tannins produce more of these metabolites than the fiber did. So if you look on the right over here, the total short chain fatty acids, both of them individually outperformed inulin. She told me later that when she combined the two together, which is in a separate study, it was synergistically much, much higher. She circled the butyric acid there because that's the one that's butyrate. That's the one that a lot of people talk about. You'll see it's significantly higher with the butyrate as well. And so it's all these things that are just so exciting because I'm going to show you shortly that it's these metabolites that could potentially help heal your body and correct the SIBO that's going on. But you have to have the right microbial diversity. This is a very complex slide just looking at our microbiome. the class, family, and species of these different bacteria that live within us. Now, the box is an illustration of what we would generally consider good bacteria. So if you have more good bacteria than bad bacteria, or the ratios are appropriate, that is how you get the full potential of the food that you eat and the supplements that you are actually taking. If you do not feed your microbiome what it wants, then the diversity changes completely. So think of it this way. We know that if you have the microbiome to begin to break these down into beneficial products, then these polyphenols can actually encourage greater growth of good bacteria, which then allows further breakdown, releasing further beneficial metabolites, and you have a positive feedback loop going on. The exact opposite can happen, which is what I'm trying to represent here with this barren land versus this wonderful tropical area. The exact opposite can happen if you're taking antibiotics on the regular basis. If you are eating a highly processed diet, there's new evidence to show that certain artificial sweeteners can disrupt your microbiome. A lot of different things can do this, but when you do not have a diverse microbiome and you try and improve it, it actually will not respond and produce these proper metabolites to help encourage this whole process. So you can have a negative feedback loop if your lifestyle and diet actually encourage microbial narrowing, then you cannot take advantage of this. I sometimes think of this when my patients will January 1st decide to go from a very, fast food style diet, and then they'll just suddenly try and incorporate healthy foods, and they feel worse after they start it. One of the reasons why is because maybe you don't have the right microbiome to help break these things down. Your microbiome has been selected to use a Big Mac as opposed to vegetables, for instance. So when we're looking at this, if you have the right microbiome, if you're taking in polyphenols, we know that large stable polyphenols can do a lot of really good things. They will decrease harmful gases, methane and hydrogen sulfide. We know that they will decrease harmful bacteria. They will decrease a pathway called NF-kappa beta, and that is the inflammatory pathway. It's the tip of the spear, so to speak. Decrease TNF alpha and other chronic inflammatory pathways. At the exact same time, they will increase antioxidants. They have anti-aging molecules in there. It'll turn on something called the SIRT1 pathway, SIRT1 pathway. It'll turn on NRF2 pathway. NRF2 is like a seesaw to NF-kappa beta. If NRF2 is up, NF-kappa beta goes down. So you have anti-inflammatory processes going on. And then there's lots of an increase in these short chain fatty acids, like I just showed, butyrate, propionate, and so on. In addition to this, there's new research looking at these various helpful bacteria that are species driven here. Akkermansia muciniphila. I love this because I click on everything. If I'm looking at Instagram, I look at anything that has gut related stuff. And so they tag it. I seem to get all the advertisements, but there's so many different companies out there trying to figure this out. And they even have Akkermansia muciniphila, probiotics exclusive, things like that. And I love it. I think it's interesting. I like that there's a lot of interest in there, but it's very difficult to get those bacteria, those probiotics, all the way to the colon where they need to be. And of course, it's all due to this microbial diversity. So I'm going to pause here for a second and just kind of recap. What we just talked about was the fact that there are a lot of medical personnel that are saying, don't worry, you just have IBS. It's a functional bowel disorder. If this happens to be caused by SIBO, I'm not trying to get you to worry, but I'm trying to get you to take action, that more than likely you need to treat this because there could be more going on, which is inflammation. And then ultimately, we need to have the right microbiome to take advantage of all these different things. I say all this because I'm super excited. I kind of took a hard turn because there's a new study that came out just recently, and it's the title of it is the neuromodulatory effects of flavonoids and gut microbiota through the gut-brain axis. In the very beginning, I told you that story of that autistic patient. That gut-brain axis, I think, is the future to probably cure one of the biggest epidemics right now, which is dementia. And that is my massively transformative goal that I want to do before I die, is possibly fix dementia so that as we live our lives and are able to remember moments like this, where you're just watching something, whatever it is. So this article is looking at how these molecules that we just talked about are able to have an effect on this. Now, they refer to these as flavonoids. Flavonoids are smaller phenolic compounds. When you put a bunch of flavonoids together, you get a condensed tannin. So when they're describing the flavonoids, they're the smaller molecules. And I think one of the reasons why they went to choose flavonoids is because they're very recognized different molecules: quercetin, rutin, hesperidin, camphoritol, luteolin, apigenin. These are all super common things. You can go to your health food store and find them on the shelves. That's why I think they went to study these, because these are the really, really common ones. Now, what is really well known is that there are so many studies where it shows that diabetes, and it shows that there's a positive benefit on diabetes, heart disease, obesity, neurodegenerative diseases, cancer, and autoimmune issues. But we have to realize that, only 1% has a direct effect, meaning only 1% of this little flavonoid compound is small enough to actually do any benefit at all. And they're known as A glycones, and they're typically very small and more lipophilic, which means that you've got 99% of this whole column on the left that depends on the microbiome to actually have the effect. So you take a flavonoid, and let's assume that you have a wonderful, healthy microbiome. If you have this healthy microbiome, then some of those smaller molecules, like the gallic acid, can actually be absorbed, but they're not ready to help out yet. It has to go through the liver first, where then some modifications are done. Then it's released back into the circulation, and they will have a direct effect as a flavonoid, as a smaller changed molecule, to help your body wherever it needs it. Now, the bioactive metabolites that I keep referring to, like short chain fatty acids, urolithin A and B, anthocyanidins, and then dihydrocamphoritol and dihydrocaffeic acid. I just put those in there because that's how elegant this is, that the dance between these molecules and the microbiome, just by changing this in a chemistry way, it's so cool that then it becomes a functional molecule that then can be absorbed and can actually help out. And of course, one other thing that I am learning about right now are the effect on neuromodulators. This is what this article really gets into, and it's the effect on something called BDNF, which is brain-derived neurotrophic factor, and NGF, nerve growth factor, GABA, serotonin, and dopamine. So there's a whole lot going on here. Now, if you're here and you're like, well, how is this relevant to me? Well, let's just go through the cycle one more time. You've been diagnosed with SIBO or dysbiosis. Probably you at least have a slight increase in NF-kappa beta pathway, inflammatory cytokines. Some of those include interleukin-6, interleukin-1, and TNF-alpha. The problem is when these are floating around, it has been shown that it creates tiny holes in the blood-brain barrier. So we have gone from leaky gut to leaky brain. So when you have leaky brain, then the white blood cell of the brain, the white blood cell, and I say this because it's not as complex as the rest of the body. The brain is so protected by the blood-brain barrier that there's one white blood cell called a microglial cell. Its job is to get rid of anything that shows up. It doesn't have a complex adaptive immune pathway that we have in the rest of our bodies. And when it does this, anything that's coming in, it's attacking, trying to get rid of, which ultimately leads to dendritic cell death. Dendritic cells are the brain cells. There's oxidative stress that then goes on, and you will lose cholinergic neurons, in addition to decreased neurotransmitters, and beta amyloid protein deposits can happen. Beta amyloid protein deposits are what causes Alzheimer's. The loss of cholinergic is interesting if you're a SIBO person because you need acetylcholine. That it is the main neurotransmitter to help with transmission of nerves, including intestinal movement.
Hey,
Now,
what's cholinergic? Just explain what that word is.
so the cholinergic is the cells use acetylcholine to start the impulse. And so if you don't have that, you can't even start the impulse of the nerve to then release serotonin, dopamine, and so on. Acetylcholine is the neurotransmitter in a cholinergic neuron that continues the pathway. So you need acetylcholine to get your intestines to move. You need acetylcholine.
So would that be something that we could buy over the counter as a supplement? Because I've seen that in supplements.
No,
no,
we can talk about that.
Okay. Okay.
Just because more than likely the acetylcholine itself gets destroyed, but you can get different things which can increase.
Okay.
You can block acetylcholinesterase, which is an enzyme that degrades acetylcholine. So you can have higher levels of acetylcholine floating around.
Okay.
So there are different things that can actually do that.
Could you repeat what it is again?
Acetylcholinesterase is the enzyme that breaks acetylcholine down.
Okay.
And there are different natural products that have been shown to actually slow that enzyme down. I think more than likely there's somebody watching this named Angie Cook, and her and I did a whole presentation. She did an elegant job. She came on the podcast and discussed her dysautonomia and discussing acetylcholine with that. And we did a whole talk for an ataxia society about how the ataxia, which is a movement disorder, can actually have lower levels of acetylcholine. And in the presentation that we co-did, she described how increasing acetylcholine can help with movement, because what it does is it actually, well, she gets into much more detail about that.
Yeah,
but,
and we have limited time today, but that sounds really interesting. And for those of you who are feeling like it's a little over your head, just take a deep breath. You're cool. Just breathe it in and just absorb what you can.
Yeah,
we're in the weeds right now, but there are a lot of people here who are beginners. I want you to be magnetized by this. And there are a lot of people who've been here with us for a really long time, and I want you to get turned on, because this is newer information and it is deep. So just hang in there.
Yeah, it's super deep. I'll just sum it up. It's very exciting for me because this kind of plays into the whole role of how do we actually protect the brain. And one of the things about this is we know that if you take these flavonoids, then you're going to block all these other things that I just said. So you're going to do things like decrease the inflammatory effect. You're going to help neuronal signaling. You're going to increase blood flow to the brain, and you're going to calm those little microglial cells down. Yeah, don't worry about the details. This is more for the rationale as to why all of this is so important, and it's cutting edge right now. It's so exciting. Now, one of the things that we talk about are these short chain fatty acids. These are, you're going to see these, you're going to see these everywhere because a lot of different companies trying to figure out how to increase these short chain fatty acids. One of them that we always talk about is butyrate, but I wanted to point this out that valerate and isovalerate, valerate helps gut barrier integrity, and isovalerate improves gastrointestinal motility. Now, that's not being talked about a whole lot in the SIBO community that I'm aware of. Those two things, if we can get higher levels of that, then I think we can start healing the gut much quicker. Now, one metabolite that I want to focus on is butyrate. Butyrate has the ability to cross the blood-brain barrier directly. So it is built to get into the brain where it will calm all that inflammation down. It's going to improve neurosignaling, remove these beta protein deposits. It's going to help heal that. So butyrate is a key one that we want to look for to actually decrease this brain inflammation being caused by gut inflammation. This is a little SIBO alert. So for those of you that understand and have been around a little bit, I think you've had Kiran Krishnan on before, where he discussed in detail about lipopolysaccharide signaling, LPS signaling. What that means is the shell of the bacteria, when it dies, is just there as this protein. it can actually be absorbed. And when LPS is running around your body, it can actually cause this inflammation. What butyrate does is it tells your body to not overreact to the shell of this bacteria. This is super important because I heard Dr. Krishnan talk about this, where he said, we believe that LPS signaling could be the beginning of dementia. Same thing that we were talking about before. Is this all due to inflammation? If we fix the inflammation, we can fix these different processes. Fix the inflammation in the gut, and then we can fix the brain. Now, if you're taking these different polyphenol flavonoids and you have the right microbiome, then it's almost like wearing a helmet, because it increases nerve growth factor and BDNF. What that is this: if you look at this slide here, this is after giving the nerve growth factor, actual nerve growth. Then the other thing is that the BDNF increases the cells to communicate better with each other. So it ties it together. This is one of the interesting things when people have talked about how you can lose memories or how you can be smarter. It's all about the way that the neurons communicate. This actually helps these neurons talk to each other much better. Super exciting, so exciting that we've been contacted by several NFL franchises where we talk about how we can help prevent CTE and how they can begin to incorporate different protocols using this exact stuff that I'm talking about, which is why I'm so excited.
CTE, what's CTE?
Oh,
Concussion?
that's the concussion stuff. That's that all the, contact sport athletes have to deal with, boxers, football players, that kind of thing. And they don't really know how to help with that. But one of the easiest ways, I think, is to start from within. If you start from within, then you can protect the brain. Now, the other thing that we mentioned is these different neurotransmitters. This is important and very relevant to everyone here because 90% of total serotonin is produced in the gut by these cells called enteroendocrine cells. It's produced because if you take an amino acid called tryptophan, this enzyme called tryptophan hydroxylase converts it eventually to serotonin. Now, short chain fatty acids increase that enzyme, so you can increase serotonin. Now, we know that serotonin is necessary for both the brain and the gut. You've had Dr. Pimentel on where he has discussed a drug called prucalopride. Prucalopride is a serotonin HT4 agonist, meaning it actually touches this serotonin receptor. One of the problems that we may run into, which is why some people don't get better, are you lacking adequate serotonin levels? If 90% is produced in the gut and you don't have the right metabolites to turn it on, conceivably, you're lacking serotonin. In addition to that, dopamine goes through a very similar process. Tyrosine is an amino acid, gets converted to dopamine, eventually norepinephrine, and flavonoids can directly affect that enzyme, and it can turn that on. So you can have more dopamine. What that means is you're going to have more reward and pleasure, more motor control, more motivation, focus, and memory. Dopamine is key to all of this. And if you're not taking the right diet and don't have the ability to convert it, you could actually be low. It could be a reason. And then ultimately there's GABA, gamma aminobutyric acid. GABA is converted from an amino acid, glutamate, to GABA, and it's converted by the bacteria, your microbiome. The process is enhanced by flavonoids. Now, GABA is the only downregulator of neurotransmission. So it calms nervous activity, it reduces anxiety, it can actually enhance your sleep and downregulate your pain perception. So if you don't have enough GABA, that could be why the gut is causing anxiety. So one thing that we didn't have time to discuss today, but this article came out, and I'm just throwing this out there as like a cookie. An evaluation was done looking at tannins and flavonoids. Flavonoids, the study that we just looked at, looking at how it affects the biofilm and how it affects drug-resistant bacteria. And the biofilm, if you're unaware of it, It's when bacteria have the ability to form this little casing, and they can breed in there and they can do different things. Then eventually they go out. It's one of the reasons why sometimes we think that certain SIBO people have a very difficult time getting over this, because it could be that they're a biofilm there. So spoiler alert on this really quick. It turns out that these tannins, once again, the larger, more complex, it's better than smaller flavonoids to do this. Before we take a couple quick questions, I wanted to throw this out to you, Siobhan, because you have been a total Atrantil supporter. But just to recap, I know that was super sciencey. It kind of has to be in my world, because you have to have a mechanism for this. I deal with a lot of doctors that are traditionally based, and unless it's a drug, they don't want to hear anything about it. But in my mind, if it makes sense, we at least need to entertain this. And now that we've got institutions like Northwestern doing studies on their own for natural products, I'm super excited. So recap, SIBO can lead to inflammatory cytokine release. Cytokines cause leaky gut and leaky brain. Brain inflammation leads to cognitive issues and mood. Chronic brain inflammation leads to neurodegeneration, meaning dementia. Flavonoids can heal the gut directly and improve microbial diversity. And flavonoid metabolites upregulate the neurotransmitters that are needed for the gut and the brain. So what Siobhan was talking about really quick, the reason why I'm so excited about this is because I did develop a product in this space. Exactly. She has been a supporter of this since we came out. If you have any interest in taking a large tannin, which is a polyphenol, use Siobhan's link and she can tell you more about that. My suggestion is that if you do try something like this, understand that you're doing more than just gut health. You're doing microbiome health, and you're doing overall body health, including brain. So when I say that sometimes people don't take it long enough, I think that treatment over a longer period of time allows your microbiome to adapt and then eventually start producing these metabolites, which ultimately probably can help heal, which is why I see in my patient population why people staying on this for a very long time, ultimately, very long meaning several months, commit to it, end up having good success when in the beginning they didn't. And I think it comes down to the metabolites and the microbiome. And yeah, sometimes you don't realize how deep you're in this, that you actually are in the weeds. And to me, I'm like, oh, it's so fun.
So fun. It's so thank you, Dr. Brown. That was great. That was great. And
it's
yes,
a lot. I'm sorry, everyone, but I'm super passionate about it. I'm just trying to save a bunch of brains out there.
It's all good. It's all good. Okay, if you have questions, please put it in the Q&A box, not the chat. And thank you very, very much. And yes, we do have like the best price on Atrantil because I've been working with Dr. Brown and his team for so long. So they've been very generous to my community. Thank you. You'd have to order a couple of bottles to get that best price, but
it's pretty good. 33%.
That's yeah.
I think I'm losing money on that one.
Probably, don't look. But so let's, guys, we're all going to go into the Q&A box for your questions. I'm going to start being really focused on that. Okay, so Dr. Brown, a question has come up about Atrantil. Is it just for methane SIBO? So here's the thing. Let's say someone has bloating. They're not sure if they have methane SIBO, and then someone also has diarrhea in general, made from whatever cause. Can Atrantil help all those people or just people with bloating from
it can help
SIBO?
It can help all those people because the antimicrobial effect in the study where I discussed the tannin, it also discussed the antifungal effect against Candida in that study. It can help. So the root cause is always going to be bacteria and bacteria producing gases, whether that gas gets converted to methane or that gas gets converted to hydrogen sulfide. What is unique, and the reason why the studies were done, is because there was really nothing to help nothing to get rid of the Archaeobacter. And so that's how come that was how we came out. but we do use it for both diarrhea and for constipation.
And what if you're on it for several months? Let's do this. People who have tried it, who's it not for? I'm going to start there. Who's it not for? Peppermint people? You've talked
Yeah,
about
so
that.
we have some people that are sensitive. Like we have found some people that are really sensitive to whatever, either the chestnut or the peppermint. So if you're, you know, sensitive to it, there's not a whole lot we can do about that. I generally don't recommend it for anybody that's on a narrow therapeutic drug, like a rejection drug or a blood thinner or something like that, because we didn't do any studies head to head with that. And it's not worth the risk, in my opinion, that if you are on an anti-rejection drug or something like that. And I think that should be considered with every single supplement out there. And we didn't do studies on pregnant women and on breastfeeding, although it doesn't get absorbed. And so many of our employees have actually taken it through that, but I can't recommend it because we haven't done studies on it. And so other than that, it's probably something that you can give it a whirl and see.
And does it, so Roscoe's saying, will Atrantil increase motility and hence diarrhea? And is it okay to take with rifaximin? It's not, it doesn't really, like, that's not the mechanism, right? It's not about, so can you just explain that? Because that's the whole point was about that whole buildup that he just did was about microbiome and the nutrients in our diet that we may be lacking, but it's not an motility increaser like a prokinetic.
Correct. So what that is, and this is why the metabolites are so important, the longer that you stay on that and the better your microbial diversity, you will produce these metabolites, which encourage the proper movement where it's needed. Meaning if you need a little bit more, it'll go up. Meaning if you little bit less, it'll go down. And that's not the product itself doing it. It's letting your body do it, but you're giving the tools to allow it to do it. You can do I mean, if you had a very strict, polyphenol diet where it's, bowls of berries, you could accomplish the exact same thing, but it's the equivalent. You need like 4 bowls of berries for 2 doses kind of thing. So because we use these tannins.
It's a food grade. I mean, if you think of it,
it's
a food.
It's a food. It's what makes like big Cabernet wines have that little aftertaste. Those are the tannins there. That's why one of the reasons why people think not just resveratrol is a flavonoid, but it's the tannins in wine that could be beneficial for your health.
Let's see. On a past presentation, Dr. Brown had mentioned something that he noticed is found in the colon of people with colon cancer. Was it that you noticed hydrogen sulfide?
So we did do a presentation at some point where there's a link with hydrogen sulfide, and the slide, I don't remember where I gave it, but I did the good, the bad, and the ugly, the old Clint Eastwood thing there. And, the ugly is that hydrogen sulfide, if around long enough, can actually encourage cancer, colon cancer cell growth. So,
whoa, that's
I'm not saying it'll happen. I'm just saying that it has been shown in animal models that can actually take place.
Okay. Let's say someone's trying Atrantil. So like, for example, Carla, hey, Carla, literally several years ago, my Chiro FM, so functional medicine provider, had me try Atrantil for chronic diarrhea, but it didn't help. However, I only used half the bottle and per whatever dosage on the bottle. Is there a specific dosage for diarrhea that's different than the label? And that's the thing. That's really not probably long enough to take it. But what do you do for people with diarrhea?
We have found that if there's diarrhea, one of the things that we do is, we worked with Kiran Krishnan and, we have our spore-based version. We have seen people with diarrhea that take spore biotics at the same time. Or, we've got a physician-only line where we actually incorporate the spore biotics with these polyphenols. Tends to be a little bit better and quicker. And I don't know if that's something to do with the spore biotics changing the microbiome quicker or, staying on it a little bit longer.
Okay. When I've heard you say that, like, if you haven't noticed a difference to go longer, like up to a month even.
So when we initially did our studies, it was just 2 weeks. But then I found that these people that we did the studies on came back after they got off and they're like, I want to keep taking it. I just feel better on it. And that's where I think everything I just talked about, microbiome, metabolites, is sort of the future of where all of this is going. So taking it as a protection at the very least, you're improving your microbiome and you're decreasing inflammatory markers. The goal, because you're seeing a gastroenterologist, is that I fix your underlying problem, your SIBO, your
Thank
bloating, or
you.
your diarrhea.
Right, exactly. So I'm going to do guys, everybody, pay attention. It's Mercury retrograde. Do not type your questions in the chat. Please put it in the Q&A box. Okay, well, let's talk dosage and then let's move on from that, because we have other questions for you and I have a hard out in 9 minutes. But how many do you usually suggest of Atrantil a day?
So if you've had issues for a long time and you've been dealing with this, then definitely 2-3 times a day. With or without food. I can take it without food. We've noticed that some people that are sensitive to the peppermint do better with the food. You may notice feeling a little bit worse. We used to always think it was die-off. Maybe it's not die-off. Maybe it's that you don't have the right microbial diversity to break these down, and it will take time. So if you do feel worse, then back off 1 tablet 3 times a day, 2 times a day, 1 a day. I've had patients work their way up and then they feel amazing. And now, and at the time I just thought, oh, well, it was all die-off. It was all die-off. Now I'm thinking, no, it's all microbial diversity. You have dysbiosis and now your body is ready to take full advantage of these molecules.
Awesome. Okay. Okay, Bianca is saying, what's Dr. Brown's opinion on the elemental diet for SIBO? Could the combo of the diet and Atrantil be a good protocol for SIBO with bloating, belching, and constipation?
Short answer, yes, it's a good combo, because the way that Atrantil works is different than Xifaxin. So you've probably talked to Dr. Pimentel more recently, but last time I talked to him, it was about making sure those bacteria are happy and absorbing it. So you got to feed them so that they'll do this. The way these tannins work is they actually destroy the shell of the bacteria so that just coming in contact with it can do it. So an elemental diet with Atrantil works. Definitely. Elemental diet is hard to sustain. So that's the only issue with it. Okay.
Dr. Karen is one of your patients. Dr. Brown is my doc. Would you please bring him back again? This stuff is fascinating. Absolutely. You're very lucky to have him as your doctor. Okay. Guys, for those of you, and Clarissa, maybe you can help with this, for those of you who are sort of new to the world of SIBO SOS and you've got some awesome baseline questions, maybe you can show the SIBO Essentials link, Clarissa, and also go check out SIBOSOS.com. We have free guides there, tons and tons of information there about testing and treatment and that kind of thing. Okay, and so to answer anybody's question about how long would you be on Atrantil for, it's going to depend, but keep in mind, how long am I going to be eating food? So I'm going to be eating food for the rest of my life. And so I can't eat 2 big bowls of berries at every meal, or even really, frankly, every day. So here's an opportunity for you to use the Atrantil to help literally supplement that. Okay, let's see. Suzanne does not tolerate tannins in wine. Can I still take Atrantil? I can't tolerate fermented anything. So think of it, you're loading those tannins in something fermented in wine. So that might be the problem.
Yeah, that's interesting. I don't, since they're not absorbed, I'm wondering how you couldn't tolerate them. Are you sure it's not the sulfites in the wine? Usually it's the sulfites. The tannins themselves, being a plant compound, you're getting tannins in other places that you don't realize sometimes. Sometimes they're used in yogurt, sometimes they're used in beer. It's in other places. So I've not heard anybody tell me that they are intolerant to tannins yet, but we're all on this learning curve here. So I'm saying I'd be curious. I would be very curious to know if you could actually tolerate Atrantil, and then that would give us an answer.
Right. Okay. Let's see. Ooh, how to get Xifax prescriptions in the UK. So you could check the Canadian pharmacies. You could go to our SIBO Facebook group where people are brainstorming these types of exact situations all the time. So Clarissa will go ahead and put the link for the Facebook group in there. Let's see. Yep. Hang in there, Lucy. We're thinking of you for sure. Let's see. Drug-resistant Campylobacter. Talk to us about that.
Yeah, so that little teaser that I just did with the tannins, that's what that study was looking at. It was looking at drug-resistant products, and it's fascinating because I mean, I'm such a geek about this, but when I see articles that come out where they're discussing the increasing amount of drug-resistant bacteria, what they're referring to are traditional antibiotic drug resistance. We need to start thinking about other mechanisms to get rid of these bacteria so that we're not making superbugs all the time. So that's my thought on that drug-resistant Campylobacter, if you actually have a Campylobacter infection that is drug-resistant, whenever you have something like that, you can send a stool culture and they will do a sensitivity on that and find which combination of antibiotics actually will get rid of that. So whenever you have anything drug resistant, make sure they send off a culture.
And
it's called culture and sensitivity.
Culture insensitivity. Okay.
Culture and sensitivity. Your doctor can order that.
Okay, good. Yeah. Okay. Judy says, I have gastritis. Can I still try Atrantil?
Yes. So gastritis is kind of a term that we use all the time, which is non-specific inflammation of the stomach. Yes, you can use Atrantil. Some people that have gastritis, the chestnut in it can be a little bit irritating, so do it with food.
Okay. Okay. Do not get SIBO Panic, anybody. SIBO Panic is a problem, and I understand it's hypervigilance. It's a problem.
Yeah.
Everybody take a breath.
I'm gonna apologize. Do not confuse my enthusiasm about this new research that's coming out by trying to scare you. I'm just excited because I think that we're heading in a really cool direction. People are starting to researchers around the world are really starting to look at these different things. And once this cracks open, these metabolites in the microbiome, it's going to be so exciting because we don't have to always depend on big pharma to find our solution.
It's very, very exciting. Okay, too many questions to get to today. But does Atrantil dissolve biofilms?
That's what that was my whole teaser. That was the whole teaser article that I just found. It actually showed that it dissolves the biofilm superior to smaller phenolic compounds, the flavonoids. And that was the first time that has actually been shown in drug-resistant things that produce these aggressive biofilms. So yes, and maybe that's why over time, these are all moving targets. Maybe that's why over time taking the Atrantil longer, because possibly it starts dissolving the biofilm. Who knows? Right.
Any problem with using Atrantil on blood thinners?
That's one of the issues. So that's where I get a little bit nervous. If you're on a blood thinner, let's say Coumadin, which has a narrow therapeutic window, we haven't done studies on that. I would just hate to think that there's some weird binding of the drug that we don't know about, and then the consequences are. So I'm very risk averse. So I would say no. If you're on a blood thinner, please, and if you're on a blood thinner, really consider anything else that you're taking could be manipulating that.
Okay. Everybody pop some love into the chat for Dr. Ken Brown.
I feel bad. My wife told me last night that this was too sciencey, but I was too excited about it. So
you know what? Sometimes, you're here, you all made your own luck. I thank you all so much for coming and absorb what you can. You are going to get the replay tonight, so you can replay it in the background. This is a great opportunity for you to expand your brains and to go to the next level, because there are a lot of times we do stuff that's a little bit more basic, and there's a lot of times that we do stuff that is going to help you stretch your minds, which is what we're here for as well. So don't leave it.
If anybody has any questions, we're on Instagram. It's at Gut Check Project, and just shoot a direct message if you've got questions. We'll be happy to talk.
That's a nice offer. That's a nice offer. Really nice offer. Thanks. So it's is it Gut Check Project on Instagram?
Gut Check Project. Yeah, it's at Gut Check Project. Yeah, that's our podcast where Eric and I cover a lot of other stuff like this, and sometimes we get real sciencey, sometimes we just get really silly. So.
Okay, we like it all. Thanks, everybody. Thanks, everyone on Facebook. Be sure to keep opening your emails so you can get more information and the replay. And thanks for being financial. If you guys do decide to order Atrantil through our link, if you don't, that's fine too. We're glad you're here getting smart and feeding our microbiomes and our brains together. So be well, everyone. Thanks, Dr. Brown. Talk to you later.
Bye, Siobhan. Thank you so much.
Bye-bye. My pleasure. Talk soon. Thanks all.